blood pressure taking. So the definition is the pressure exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. So the purpose is to determine vascular resistance to blood flow and to determine the effectiveness of cardiac muscle in pumping blood to overcome the vascular resistance. So our equipment is blood pressure apparatus, sphygmomanometer, stethoscope, and paper and pen. So our first procedure is to identify and explain procedure to the client. Rationale is to ensure right procedure is done to client and gain the client's cooperation. So, good afternoon, sir. I am Al-sodaire Mangatong. So, how are you, sir?
Buti naman.
Second procedure is to assess the client's physical status to ensure that the client is rested and to identify the affected side of the client. The third procedure is to determine the client's baseline blood pressure. So the rationale is for comparison of results during monitoring. So sir, yung nakaraang blood pressure nyo po is 120/70. So basically normal naman po siya, no? So check po natin yan mamaya kung may nagbago po ba or kung tumaas po ba yung blood pressure nyo sa bumaba. The next procedure is to assemble the equipment to promote the efficiency of the healthcare provider. So the next procedure is wash hands to decrease the transfer of microorganisms. So the next procedure is to place client in a comfortable position, lying or sitting, and position the arm at the level of the heart with the palm of the hand facing up. Preferably use left arm because it is nearer the heart. So the rationale is this position places the brachial artery of the inner aspect of the elbow that a stethoscope this can rest on it conveniently. Having the arm above the level of the heart causes a decrease in BP. The next procedure is wrap the deflated cuff evenly around the upper arm. Locate the brachial artery. Apply the center of the bladder directly over the artery. For an adult, place the lower border of the cuff approximately 2.5 cm, one in above. So the rationale is to pressure in the cuff applied directly to the artery will give the most accurate readings. So the next procedure is wrap the cuff around smoothly and snugly. Not too loose, not too tight. So the rationale is a smooth cuff and wrapping procedure equal pressure and to give accurate reading. A cuff too loosely wrapped will give inaccurate reading. The next procedure is estimate the systolic pressure. Palpate the pulse of the brachial artery, inflate the cuff, and note the reading when the brachial pulse disappears, then deflate the cuff. So the rationale is to prevent underestimation of the systolic pressure or overestimation of the diastolic pressure. So wait for 1 to 2 minutes before making further assessment to prevent false reading. So the next procedure is place stethoscope, earpiece in your ears, and close screw valve on the air pump. So the rationale is sounds are heard more clearly when the earpiece follow direction of the ear canal. The next procedure is palpate brachial artery to turn valve clockwise to close and compress valve to inflate cuff to 30 mmHg above points where palpated pulse disappears to get accurate result. So the next procedure is release the air in the cuff slowly so that the pressure goes down at the rate of 2 to 3 millimeter. So if the air released too slowly from the cuff, there will be congestion in the extremity causing false reading, and if it is released too rapidly, sounds may not be heard at accurate levels. So the next is listen for the sound. First, distinctly loud muffling sounds in systolic pressure. Continue to release the air evenly and slowly. Last soft muffling sound is diastolic pressure. So to get accurate results. After the final sound has disappeared, deflate cuff rapidly and completely to release the remaining air from the cuff and prevent congestion in extremity. Roll the cuff and place it in the case. Wipe the earpiece of the stethoscope with the antiseptic swab and outback its proper place. This method of removing dirt prevents possibly infection of the ear. So the next procedure is wash hands to prevent the transmission of microorganisms. Evaluate the nature of blood pressure to compare from the baseline data. So sir, yung nakaraang blood pressure niyo po is 120/70. So ngayon po ay same naman po sila kaya normal naman po. So record the result taken for monitoring purposes. That's all.